Welcome again, folks, and thank you all for joining us here today for our webinar on occupational health and safety during COVID-19. My name is Norma Jean McPhee, and I'm the Events and Marketing Coordinator for the Cape Breton Partnership. Before we get started, I'm going to ask my colleague Jeremy to join us to describe some of the functions of this platform.
Thank you very much, Norma Jean. Can you hear me there?
I can hear you, yeah.
Fantastic. Welcome, everyone. Thanks a lot for joining us. 58, 59, 60. Perfect. We're using Zoom for this call today. So for those of you who have not used this before, Zoom enables us to show everyone our faces and talk with you and show our presentations. The webinar feature enables us to have you ask questions to our panelists. So if you look at the bottom of your screen, you're going to see a Q&A tool. If you have any questions during the presentations, please click on that tool and type in your question, and the question will go into a queue so that our panelists can see them. We're going to hold the question until all the questions until the end of the presentation, and I already see a hand up, but I'll tell you now, no one can see you, no one can hear you. So if that's your question, no worries, you can walk around freely. We won't see or hear what you're doing. So yes, you can use the Q&A tool to ask any questions you have, and we'll hold them to the end of the presentation, and then we'll make sure that they're all answered right here live. You'll also see the chat function down below. If you have any technical difficulties or if you would like to make a comment, please use that chat function and type in anything. As we see any information that we'd like to share, we'll also click share and type in an email or phone number or a web link, and all of that information will be there for you as well. In the meantime, we hope you enjoy, and we will hear from you very soon. Norma Jean, you can take it away.
All right, thanks, Jeremy. Keeping us afloat here with our Zoom webinars. As we all together continue to navigate this new and very different world of COVID-19, our hope is that everyone is staying healthy and safe. And in particular, this week is National Health and Safety, Occupational Health and Safety Week, which is another reason why we're having this theme today. One of our primary purposes at the Cape Breton Partnership is to connect Cape Breton entrepreneurs and companies from any industry to the support, information, and resources they need to be successful, which of course includes today's webinar. If you missed our previous 9 webinars, you can watch them all on our website, capebretonpartnership.com, and on there there's a link to the COVID resources page, which will take you into Facebook, and you can watch them all at once if you wish. They cover topics from mental health and well-being, legal concerns, and also cybersecurity. On our website, there's also other COVID-19 related resources available, which we update regularly. As Jeremy mentioned, after all the presentations, we will then open the floor up to questions and answers. These webinars always go better with lots of questions, so if you think of them, you can put them in the Q&A function, and we will get to them. But I also did want to mention that you're going to hear from someone just right out in 1 second here from the Workers' Compensation Board. And any of the questions related specifically to client-specific questions, we cannot answer those in this forum due to confidentiality. But however, of course, all general questions are indeed welcome. So without further ado, I'm going to introduce our first presenter today is Kelly Johnston Noseworthy. Kelly is the Relationship Manager with the Cape Breton Integrated Service Team of the Workers' Compensation Board of Nova Scotia. So over to you, Kelly.
Thank you for joining us today. As Norma Jean introduced, my name is Kelly Johnston Noseworthy, and I'm from the Workers' Compensation Board. Our mission at the Workers' Compensation Board has always been to keep Nova Scotians safe and secure from workplace injury. Through these challenging and unprecedented times, the health and safety of our employees and those we serve remain our #1 priority. While we have suspended our in-person service, our important work to support Nova Scotians continues. The pandemic has affected the way we deliver services, and the following slides will highlight the changes and updates to our operations and link you into resources to help you navigate through COVID-19. We're going to show you 2 websites today, mainly our main website, which is wcb.ns.ca, which has a link to the update of our operations. On our running page at the home site, you will see a link to COVID-19. It's a purple bar. If you click on that, it will bring you to this site. WCB continues to do its part to help reduce the impact of COVID-19. This website will show you the changes that we've made in our operations in response to the pandemic and provide you with available information for workers, employers, and service providers during this time. As always, if you have questions or concerns, you can reach to us during business hours at our 1-800 number, which is listed there, or if you're registered through My Account and secure messaging. The tabs on the left show you links to information for workers, employers, and service providers. But for today, given that this is employers that are attending the session, I will be highlighting some of the information for the employers. However, by all means, you can check the links for workers and for service providers as well. All services to employers are continuing, just a little differently. Although our facilities are closed and most of our employees are now working from home, the core function of our services to employees will continue. Claim registration and assessments are continuing, and we're supporting prevention and return to work in workplaces. Most of our services continue, they're just being delivered from a distance. Case conferences, visits from field reps, and other in-person services are examples of how our services are being offered differently at this time. They are happening virtually or by phone. You can always leverage our technology, if you haven't already, by registering for My Account to help you communicate better with us. Most employers who have workplace injuries manage them through My Account now, and you can stay in touch via secure messaging. Another update on service is our premium payments have been deferred for 3 months, with interest and late payment fees waived until further notice. This has been in partnership with the province of Nova Scotia, and therefore all WCB payments have been waived for employers or deferred through till July. As you may well know as well, our final paper clearance letter was mailed out in March. So Nova Scotia's clearance letter for April through to June has been mailed, and this will be our last paper clearance for WCB in mass mail to all employers. From now on, you can access it digitally via My Account. The second web page that I'm going to show you today is our Resource Hub. This is for Nova Scotia workplaces to help you work safely through COVID-19. It has links to 4 sections, as you can see on the landing page over on the left. These 4 sections include news and updates, working safely by industry, so you can look at each industry tip sheets, new ways to work safely, and then links to prevention, tools, and resources. I'm going to go through each of these 4 sections independently so I can highlight some of the information that is within. On our first site is the news and updates, which provides you with an update or quick links to the latest news and information about COVID-19 and how it impacts workers, employers, and all Nova Scotia workplaces. The WCB tab will provide you with information and updates about WCB Nova Scotia's business operations for employers, workers, and service providers. The Nova Scotia government website will provide you information on the COVID-19 pandemic from the government of Nova Scotia with some latest directives and from public health and advice about prevention, preparation, social distancing, etc. The Government of Canada link will provide you details about the current situation, tips to protect your health, prevention tools, and the national response to the pandemic. And then we also have links from HRM and CBRM municipalities, which provide some service updates and include some emergency management office information as well. And lastly, we have the World Health Organization link, which provides you with some public advice and answers to some commonly asked questions. The second section on this website provides us with some information on injury prevention by industry. There's a quick 30-second video on the top of this page, which provides you with tips working from home and also some customer-facing service tips as well. Then you will provide links on each industry on prevention tools and resources. So currently we have 6 industry sectors that we have some tips and resources in, which include healthcare, manufacturing, construction, retail, trucking, and food services. Our third link is our new ways to working safely. This is our new Workers' Compensation Board awareness campaign, delivering messages to workers and employers in all Nova Scotians about new ways to support safety at work during COVID-19. It also has links to our radio ads and video ads, which you may have seen recently as they've been posted as of Friday. You can link into these and watch them yourself or share them with your staff. And finally, on this page is our links to resources, where we have prevention tools and resources that will link workplaces to prevention needs provided by local, national, and international public health, workplace, and industry safety organizations. We include in here some things from the Canadian Occupational Health and Safety website, which is free online products and resources, the Canadian Mental Health Association of Nova Scotia with a wellness resource hub, the World Health Organization, which provides some guidance for schools, workplaces, and institutions. The AWCBC is the Association of Workers' Compensation Boards of Canada, which provides tools from all other workers' compensation boards across Canada. And the Canadian Standard Association has made up a selection of relevant standards available at no fee view access through their online platforms. You can also view or download a WCB tip sheet on working safely from home. And if you do have some staff that are working safely from home, there's also some guides in there on ergonomics to help manage the organizing of working from home safely. And then we have a couple other resources in this link with respect to respiratory hazard guidelines and mental health at work resources as well. So this week is Safety and Health Week, formerly known as NAOSH. So just wanted to provide you with a little bit of update of some of the things that the Workers' Compensation Board are doing this week to help support our Safety and Health Week. The first one is radio and video ads. I see a typo in there. So of course our radio and video ads are running through today, this week, and you can link through them on our resource page as well. We also have a blog per day with some topics including safety leadership. Nova Scotia Power are doing a blog, slips, trips, and falls, internal responsibility system, and one on MSIs and working from home. We also have some new posters directed at some focus work on industry, but we also have it as a general connection as well for posters. So it's just a general, not specific to any industry, that you can either have delivered by ordering them through our website online, or you can actually download them and print them yourself. We also have a safe and secure newsletter that goes out, and that can be accessed through our website. And we're active on social media via Facebook, Instagram, Twitter, etc. And we also have some digital signage. If you have some digital signage that you would like to have some access to, it's available through our website as well. Just link in there and you can request it. Lastly, I just kind of wanted to chat a little bit about how we've transitioned our organization to work remotely with respect to some claims. Benefits, the COVID-19 pandemic will not impact the ability for us to pay benefits to our workers. We have transitioned our organization to work remotely, including all ongoing payments and services being offered to workers. And although it means delivering services a little bit differently, we still are here to support our workers as they are returning to work. Our facilities are closed and in-person services are postponed. Following the advice of public health officials, most WCB employees are working remotely and our facilities are closed. In-person meetings and case conferences or exams or lobby services have been postponed until further notice. But services are continuing wherever possible, enabled by technology. You can also sign up for online channels and direct deposit, so workers can have their checks deposited directly. Most of our workers actually currently receive their benefits through direct deposit. But if you have not registered yet for My Account, you can do so by visiting the wcb.ns.ca website and register for My Account where it says WCB Online. Health services may look a little bit different during this time, following the direction of public health. Most physical clinics have directed to close except for emergency or urgent care. This includes physiotherapy, psychology, occupational therapy, chiropractic service, etc. In these cases, protecting the health of the worker and the service provider is of paramount importance. Specific to COVID-19 related claims, every claim is different, including our claims related to COVID-19. As with any claim received, the Workers' Compensation Board of Nova Scotia will adjudicate claims related to COVID-19 on a case-by-case basis. As set out by the WCB Act, compensation is only available for a work-related injury or illness. It is not provided for workers who cannot work for preventative or precautionary reasons, such as self-isolation or quarantine. If somebody becomes exposed at work, the infectious disease as it relates to WCB is set out in the Workers' Compensation Board Act. Benefits or services are available for work-related injury or illness, including a worker who contracted the infection disease such as COVID-19 during the course of their employment. All claims are adjudicated on a case-by-case basis, and to determine if a claim for COVID-19 or any infectious disease claims is compensable, we follow a thorough process of gathering, analyzing, and weighing information. Lastly, my slide, the last slide actually has our links into our websites that can provide you with some more information. The one I didn't talk to very much here is the support.wcb.ns.ca, which gives you some quick updates on what you may need to know from an employer, worker, or service provider perspective, and it's up-to-date and recent information. And then also a link into the My Account register sign-in. Thank you.
Thank you, Kelly, for all that great information. And the slides contain lots of great info, and it wasn't until the end of your presentation that we couldn't hear you great, but thank you. And coming up, we are going to hear from Don Martel. Don is the owner of an occupational health and safety consultant at Strait Area Safety Services. Over to you, Don.
Thank you, Norma Jean. Okay, not sure if everyone can see me or hear me or not. If I could get a reply there from someone.
We can hear you great.
Okay, perfect. Seems to be something stopping the presentation from moving.
Do you have the share screen function open?
I can't pick up right now. Here we go. Okay. So we'll see if I can go back here a second. Okay, so my name is Don Martel. As Norma Jean mentioned, I'm the owner of
Don will just get you to share your screen as well.
Okay. Hey, Jeremy, where is the, I don't have the, oh, hold on one second. Okay, no, just gonna bring up the Zoom here.
So on the bottom of the Zoom window, there's the share screen.
There we go. Yeah, I got it now.
Perfect.
All right, can you see okay there now?
Yes, we certainly can. Thank you.
And the voice is fine?
Perfect.
Okay, so start again. So my name is Don Martel, owner and operator of Strait Area Safety Services in Richmond County. I service the Strait Area mostly. I'm a Canadian registered safety professional, and I retired in 2016 from the Department of Labor as an occupational health and safety officer. So today I'd like to speak to you about COVID-19 in your workplace and how it affects you as employers. and maybe give you a couple of tips as to how you can work with that if you are an essential service and you're actually still operating from your work site. So hope you enjoy. So as we know, COVID-19 is now one of the newest hazards for all workplaces. And while the virus itself is of a serious nature, we need to keep in mind as employers, we still use the same hazard assessment process for COVID-19 that we would for any other hazard. It's not the virus itself that we need to deal with as employers, but rather the hazard. And for that reason, we use the hazard assessment and the hazard assessment tools the exact same way as we would for any other assessment, for any other hazard that's noted in the workplace. So we'll talk a little bit about the legislation. So the Occupational Health and Safety Act in Section 13 talks about the employer's precautions and duties. Every employer shall take every precaution that is reasonable in the circumstances to ensure the health and safety of persons at or near a workplace. Now that's a pretty broad statement. When we're saying every precaution that is reasonable in every circumstance, and note that it says persons at or near a workplace, it doesn't say employees, and that's because you're responsible for anybody who's on your work site, whether it be an employee, a client, visitor, a vendor, salesman, whichever one it may be, you're responsible for all of them. So it's also your duty and precautions to provide such information and instruction and training, supervision and facilities as are necessary to the health and safety of your employees. Next, we have ensure that the employees, and particularly the supervisors and foremen, are made aware of the hazards that they may come into contact with at your workplace, and COVID-19 being the newest one. And then we have to ensure that employees are made familiar with the proper use of all devices, equipment, and clothing or PPE that's required. And of course, for COVID-19, things are going to change a bit. It's going to be new equipment and stuff put in place. And we have to ensure that the employees are familiar with that along with supervisors. And of course, the last one is conducting the employer's undertaking so as to not expose health and safety hazards to the employees during that undertaking. And going forward into legislation, the employer should ensure that they consult with the Joint Occupational Health and Safety Committee. And where there's not a committee, if the numbers warrant, you'd likely have an occupational health and safety rep. So you have to consult with either one of those. The committee and the rep are the employees' right to participate. That's where they get it from. You can't bring every employee into your meetings, but you certainly can bring the representatives that they've chosen to represent them. The next one is to cooperate with any person performing a duty that's been conferred onto them by this act. And what we're speaking of there is an occupational health and safety officer or a hygienist or an engineer from the department that may visit your workplace. You certainly have to accommodate them when they come in. We'll talk a little bit about the order that was issued by Dr. Strang, or the good doctor, as Premier McNeil would call him. In this order, they define self-isolation. It means the requirement of any person who has COVID-19 to remain separate from others in such places and under such conditions as to prevent or limit the direct or indirect transmission of COVID-19. Self-quarantine means the requirement of any person who has been exposed or may have been exposed to COVID-19. So there's a couple of differences here. If you look at the blue highlights, the requirement is on the person, not the employer. Now, that's not to mean that the employer doesn't have responsibilities here, but the way it's written in this order, it puts the requirement on the person to self-isolate or to self-quarantine, not for the employer to have to tell them, go on home and self-quarantine, okay? And note that in self-isolation is a person who has COVID-19 in the yellow highlight, and under self-quarantine, it's a person who's been exposed or may have been exposed, okay? Now, close contact is not defined in the order, but in reading through the order and through all the resources that the province has put out, close contact is defined as a person who provided care for someone who tested positive someone who has been in close physical contact with someone who's tested positive, someone who lives with someone who's tested positive and doesn't practice social distancing, or someone who's had direct contact with bodily fluids from someone who tested positive. Now you may say, well, I don't work in the medical field, so there's no way that's going to happen. But this could happen anywhere. So if someone who's infected coughs or sneezes in an area less than 6 feet away from someone, then there's a possibility of infection. So to move on with the order, in Section 3, the order was issued on March 23rd. And in Section 3, it speaks to people who have been identified as a close contact, a person who is diagnosed with COVID-19, or a person who's been tested and awaiting the results. All of these people either have to self-quarantine or self-isolate, as the case may be, for 14 days from the day of finding out if they've been exposed, or if they've been exposed to a close contact, or if they're awaiting results of a test. So, in the next section, in Section 4, it talks about exempted essential workers. What we have to remember about this section is that these workers have to be healthy. Everybody's saying that essential workers are permitted to do this, permitted to do that. They are, but only if they are healthy. So workers who are essential to the movement of people and goods are exempt from requirement to self-isolate or self-quarantine. However, they need to be healthy. And in the first one, in A, it talks about the trade and transportation sector, or employed in the movement of goods and people by land, air, or sea. In B, it talks about people who have to cross borders to work, particularly in healthcare, any essential service. And again, they have to be healthy. In C, it speaks about people traveling into Nova Scotia for essential health services. And that speaks more to, for example, an ambulance that would come in from New Brunswick or PEI. There's a support person there. One person has to drive, one person has to attend to the patient. And again, they have to be healthy. And then, of course, there's workers who work for the pharmaceutical businesses carrying on business in Nova Scotia. And again, they have to be healthy. So the key is that they have to self-monitor, and they have to identify if they've been in close contact or if they have any symptoms. And if they did, then we go back to the isolation or the quarantine. So we'll move on in the order. In Section 5, workers exempt under Clause 2 must still, when they enter the province, practice social distancing of 2 meters. And again, they must closely self-monitor. If they identify any symptoms or exhibit any symptoms, then they need to self-quarantine or self-isolate. In Section 6, all persons present and residing in Nova Scotia must maintain the social distancing of 2 meters and gatherings of less than 5 in a group. And that's for all other persons that are residing here. In Section 7, they talk about social distancing being required for non-for-profit organization. In 8, we talk about the 5-person rule for non-profit organizations. And in 9, we talk about the 5-person rule in Clause 6 does not apply to a business or an organization that can maintain social distancing. When we think about that, we could think about a grocery store, a large grocery chain. You walk in there, you may see 20, 30 people shopping, maybe even more. But that's because the facility is large enough that if people abide by the 2-meter rule, we don't have to worry about the 5-person, okay? So in Sections 10, there's employers who are exempt from the 5-person rule, and for the reasons we just stated, the size of their facility. In Section 11, there's an exemption for police, fire, and EHS, and municipal services, and we see how that happens with that tragic shooting in Port-au-Peak, how closely the first responders had to work with one another. So that's why that exemption is there. And in Section 12, right up to 22, we speak about closures from everything from schools to market break cancellations. In Section 23, we talk about failure to comply with this order and what can happen to you if you do fail to comply. In Section 24, the direction to follow the order, the same as in any regulation or act. There's always a clause there that directs you to follow what it is that's been written. And in section 25, the timeline of the order. And of course, we all know that they have provisions in there to allow them to extend the order and renew it. So that's basically Dr. Strang's order. There's 25 sections, and a little further on in my presentation, there'll be a link where you can find that. So as far as the employer's roles and responsibilities for the employers that are listening today and due diligence, it really doesn't matter what industry you're in. If you're in essential service, if you're in essential workplace, the first thing you'd want to do is immediately implement some of the recommended prevention strategies of physical distancing, self-reporting, no face touching, frequent hand washing, physical barriers, proper cough etiquette, workplace sanitization, and self-isolation and quarantine if you've traveled. So in order to implement these at your workplace, you would likely want to develop a questionnaire for your employees, depending on the amount of employees you have. And most workplaces, what they're doing is they develop a questionnaire, they provide it to the employees, and they ask them to review it on a daily basis prior to coming to the site. Not to fill it every day, but to review it mentally to make sure that nothing has changed overnight. And what you're looking for, of course, is symptoms, or if you've been in close contact, or if you've traveled. Once you develop the questionnaire, if you happen to find someone who answers a yes to some of these questions, you would need to have a written procedure on how to deal with that. So if an employee would answer the yes, I've developed symptoms, for example, then you'd need to have a procedure on how you're going to handle that when that person is arriving at your work site. Once you've accomplished that, you would want to complete a hazard assessment of your work site to determine the areas of the work site where contracting COVID-19 may exist, or what the highest risk would be of contracting COVID-19. And then you would develop and implement written safe work procedures and control all identified hazards that you've identified during that hazard assessment. So I've compiled a non-exhaustive list of common hazards here. They may not cover everything, but they will certainly give you a pretty good start if you are in essential service. So obviously contact with another person for work-related tasks would be the first one. Meetings and training sessions where you cannot maintain the 2-meter rule. You have to work around that and somehow either maintain the 2-meter rule or maybe have them video conference such as we're having today. Lunch and break times are another one where you can't maintain the 2-meter rule, and a lot of times what they do there is split up the breaks, so lower the number of participants, and that way you can meet the order. Touching commonly touched surfaces, and I won't cover every one of them, but you can look back at the presentation later. Employee displaying symptoms after arriving for work at the work site, or where a colleague, another employee, notes that an employee is displaying symptoms. So you'd want to have that written down and how you would deal with that at the time. As an employee traveled out of province, that could be another hazard. This one here, the last one, is more than one person per vehicle on a work site, but this also includes carpooling. There is information available out there through the province, and I will provide a link for that as well. A lot of people carpool to work, and if you're not from the same household, it's supposed to be a no-no. But if you have to and you have no choice, there are provisions for that as well in that literature and the resource that I'll share with you. And of course, always advise the JOSH committee and the OH&S wrap up the hazards you found, because they are the voice for the rest of the employees. Let them know what the hazards are and let them know what we're doing in order to deal with those hazards. So the hierarchy of control, once you've identified your hazards that you'd want to lay out, firstly, you'd want to try to eliminate the hazard. If you can't do that, substitute something that's less of a risk. And then you go into engineering controls, and then administrative controls, and then your last line of defense would be your personal protective equipment. So, for example, if you'd want to eliminate any non-essential activities, which can be delayed until the hazard has passed or the threat has passed and has been resolved. For substitution, you want to substitute with a less hazardous method. So for example, if you need 2 people to do a lift of an object or a box, and you can do that lift with a lifting device, then you would eliminate 1 person, which means a threat would be gone. So therefore, that would be a substitution. In engineering controls, it's basically guards and barriers. So physical barriers, plexiglass or other forms of enclosures. We see these plexiglass everywhere now. Redesign of common rooms, so boardrooms, lunchrooms and whatnot. And of course, workstations where you have cubicles and you can't maintain that physical distancing. If you can adjust for that, then all the better. To control human traffic patterns, a lot of people are using one doorway to be an exit and one to be an entrance, and that's to avoid people meeting each other in congested areas. So you'd want to do that. Strategically placed alcohol-based sanitizing equipment. That would be another engineering control. Dedicated hand washing facilities throughout the facility. And of course, reinforced personal hygiene measures as well. And workplace cleaning frequency. And for those buildings who are equipped with HVAC ventilation systems, and you need to make sure that they are in fact working. Administrative controls are more in the paperwork side of things. So first of all, if you can accommodate your staff to work from home, that's a great one. As Kelly mentioned earlier, most of the staff at WCB are now working from home, which is a great thing. You know your staff are protected, and you know you're still going to have your staff at the end of this. Split shifts, as I mentioned earlier, if your workforce is large enough, you split shifts in order to accommodate in lunchrooms and for meetings. And the other thing that it does, if you do happen to have an outbreak on the site, your whole workforce has not gone home. You've got the outbreak on one shift, and then you work around that and make arrangements so that the other shift doesn't get infected. Eliminate document sharing unless electronic. A lot of workplaces have work permits, compliance-based permits, stuff like this. And in the past, everyone involved has to sign off on these documents. If you can do it electronically and have 1 person designated to receive permission from everyone to sign off on it, that would be a great idea to promote one-touch document systems. Reassign high-risk individuals, so anyone that's above 60 or immunocompromised, you'd want to reassign them to where they wouldn't be exposed to the risk. Personal protective equipment, the last line of defense, as we mentioned, at times, additional PPE is probably going to be required for exposure to COVID-19. And employees must be trained, always remembering the use and maintenance of PPE. So do not share the PPE with other employees, obviously, for COVID-19 purposes. Proper storage of your PPE once you've used it and you've cleaned it and disinfected it, and you need to make sure it's properly stored. Do not allow employees to bring their PPE home. You don't want anyone bringing that back to their family. And when physical distancing cannot be achieved, some of the PPE that could be included: respiratory protection, and remember, fit testing would be required. Disposable medical gloves, coveralls, and of course safety glasses and shields where required. So then we get into, we've identified the hazards and we've come up with some controls. We want to develop written safe work procedures. And once we have them developed, we want to train and educate all our employees on those safe work procedures. Have the facilitator who's going to provide that information document who is in attendance, but once again promoting that one-touch document rather than have them sign off that they've attended. Facilitator can certainly record who is in attendance. Continue monitoring the workplace and modify the safe work procedures as required if you need to modify them. If you do need to modify them, always inform the employees of the changes. Complete field inspections, do audits to monitor compliance with your safe work procedures and the changes that you've implemented for COVID-19. The reporting procedures, of course, if any worker experiences symptoms or becomes unwell, they should obviously report to their immediate supervisor. Then you would follow the provincial reporting requirements at that link that you see on the screen. Keep the worker isolated from all other workers in order to try to prevent an outbreak at your site. You facilitate the completion of the online assessment tool. And again, it's at the link provided. And all of these links will be on the last page of this presentation, which will be available to you on the Cape Breton Partnership website. Further assessment and direction could be obtained by calling 811. How will the person be transported? You should give some thought to that. If they need to be transported from your site to a medical facility or back home if they don't have transportation. So in summary, you follow the provincial and federal recommendations and guidelines. You include the JOSH committee and the OH&S rep, and you consult with them in making decisions so that everyone is aware of what's happening, and the employees have had their right to participate, and they've had their right to know, and they know about the hazards. You complete a hazard assessment of the workplace. You implement controls through the identified hazards to that assessment. You develop your written safe work procedures. You train your staff on that and implement those procedures. You audit for compliance. You edit and amend the controls and the procedures as required and advise all the staff of the changes. There are other considerations. We don't have a whole lot of time today because we have two other presenters, but some of the things that you may have a couple of questions on is work refusals. What happens in the event of COVID-19, somebody refuses work. Expired training certification. Maybe some of you out there have people who have their training has expired. So what do we do about that? And will the employer be contacted if an employee tests positive? I do have answers for all of these, but again, my contact information will be at the end of this session. If you wish to contact me, it's not a problem. You can contact me and I'll get you the answers to those questions. What are the WHMIS implications for the cleaning supplies that are now required for COVID-19? And there are some guidelines in and around that that's been set out by the federal government. And I also have a link to provide to you to look that up as well. So for further information, all of these links are, if you click on them, they go right to the page. And they will be available, as I said, on the Cape Breton Partnership website. My presentation will be there, and you guys can look them up and use them as a resource to improve your health and safety in regards to COVID-19 at your workplace. So this is the last slide, and my favorite part of the whole presentation is this one where I do the dance of joy, either because I'm glad I'm finished speaking or you're glad I have stopped talking.
Thanks very much, Don. That was a ton of great information, and I'm sure folks will be going back to rewatch your presentation to take some notes. So thank you again. And now we will be able to get to some of those questions in just a few moments if folks want to ask those specific questions. And now we're going to head to another safety inspection specialist. We're going to hear from Jen Fahey, and she is the owner of Safety Check Inspections. Thanks, Jen.
Hi, everyone. Can you see me? There we go. All right. Hello, everyone. I'm Jen Fahey. I am with Safety Check Inspections. Thank you very much for attending today. Happy NAHAC Week. So North American Occupational Health and Safety Week is this week. The goal is to focus employers, employees, partners, and the public on the importance of preventing injury and illness in the workplace, at home, and in the community. Together, we can create a safe workplace and community. Who we are. So I'm Jen Fahey. I've worked here at Safety Check for 7 years. Recently, myself and my partners there on the right purchased Safety Check about 1.5 years ago. I handle the sales and marketing, the administrative end, organize, book courses, public relations, and relationship development. I'm also the voice you hear when you call Safety Check. I'm the one that answers the phone most times. So my partners on the right here, my partners in crime are Frankie, my husband, Frankie Fahey. He handles our projects on-site work, and Chris Angioni. Chris is a training manager here at Safety Check. So some of the services we offer, basically all aspects of safety. So we do safety consulting, training, occupational health and safety, and professional development training. We also do some OSA training for out west. We have some safety advisors. So they would go on site, be boots on the ground, do safety inspections to different clients. We offer confined space and high angle rescue technicians, and we rent and inspect confined space equipment. So here's our team. We have upwards of 18 people during sometimes of the year, but right now we're down to a skeleton staff of about 6 people. So here's some pictures of all of us and our children as well. Our location, so we're down in the Harborside Industrial Park. So we're at Stable Drive. So some photos of the inside of our training facility. So we also offer quite a bit of on-site training. So we go to the client and do training all over the Maritimes. So we do have a mobile simulator that we take on site to do confined space training. Our instructors are very knowledgeable in different areas. Each course is customized to the needs of our clients, and we come to you. So our motto is tradesmen training tradesmen. So we do focus a lot on the construction industry. However, our trainers, our on-site guys have years of experience on site doing that work themselves. Hands-on learning. We believe that this is very important whenever learning anything, is that you get the hands-on knowledge of how to do things yourself, putting on a fall protection harness, putting up staging, scaffolding, actually getting on the equipment for our power operated elevated work platform course. So today I'm going to talk to you about COVID-19, our global pandemic, how this is affecting Safety Check and our team, what Safety Check is doing in response to COVID-19, example of a pandemic plan, our clients' needs during this pandemic, online training, yay, is being offered, and NASH week, so making safety a topic. So COVID-19, the coronavirus pandemic, has impacted all of us and changed the way we all work. So how has COVID-19 affected Safety Check? So our office is temporarily closed, no instructor-led training happening right now. We temporarily laid off all our awesome employees. Availability of the employees that are still employed with us due to no school, lack of childcare, their spouse being essential workers. Reduced hours of essential services like banking, post office, anything like that. Delay in ordering and receiving supplies. So a lot of our equipment comes from China or Ontario, Montreal. So to get it here, it's usually 2 weeks, and we're now looking at 1 month to 2 months to receive any supplies. So there's my kids. So we have to take our kids to work or work from home, so you can see them there, me trying to work and them trying to help. So like everybody else, we have our good days and we have our bad days. So our plates have now become full. We're trying to work from home. Sometimes I escape in here into the office. I'm in the office now. Escape into the office to get some stuff done. We've become teachers at home, cooks, cleaners, entertainers, my poor husband, hairdressers. So what is Safety Check doing in response to COVID-19? We're doing most of our business through email and telephone calls. The odd person that we do have to come in and meet with, we are meeting with them in our training center. And so we can put a 6-foot table in between us. We're being innovative in creating online training. So this is coming up very soon. You should see an announcement here by the end of the week. created pandemic policies, which I have an example coming up for you guys, created cleaning and sanitizing practices. Safety Check has always done this. We had a pandemic plan in place with flu every year, getting our flu shots. So nothing really, a whole lot has changed for us. We always practice these safe cleaning and sanitizing practices. Created social distancing protocols, and right now we are extending our expiry dates on most of our training. We're following suit with our training partners. Like First Aid, we use Red Cross. They've extended all training by 90 days. Same with Department of Transportation for the traffic control tickets as well for 90 days. So a pandemic policy. So I'm not going to get into a whole lot of this because Dawn did cover a lot. But here's a summarized version of our pandemic policy. And again, this will be offered in my presentation. And also if you'd like a copy of it, I can email you a copy as well. So in these policies, we need these to go on site to do any work. It's required for us to have this policy. And like most other companies, you will need one. So suspected contact with COVID-19 or any other pandemic. Employee presents flu-like symptoms, confirmed case of COVID-19 or any other pandemic. Employee privacy, how to help prevent and spread of pandemic. How to deal with customers' communications during the pandemic. So here is our example of Safety Check's pandemic policy. So like I said, we can give you guys a copy of that. So this one is for Safety Check. However, you can customize it to do your own. How to deal with customers' communications during pandemics. So social distance when possible with your clients. No signatures required. If you come down with any symptoms, leave immediately, inform your supervisor, and that supervisor will take it to the client and hopefully lessen the spread of COVID-19. So pandemics and lessons learned change daily. So please stay up to date on news and suggest any new tips that may keep you, your coworker, and clients safe. So what have our clients been asking? So our phones are still on, we're still answering the phones, we're still getting quite a few calls asking us what to do. So they've been asking, well, rescheduling of courses. We've been shut down since March 15th. So our phones are ringing, asking us when we're going to be up and running. So obviously we're still closed until we're allowed to reopen. They're asking for information on these pandemic plans. And at the beginning of this, we got a lot of calls about unsafe work, so refusal of work, which I think Dawn touched on a bit there, and Dawn's going to talk more about that. But the most online question for us, our most asked question was online training. So it is something that we are developing in training cards as well. So the training cards, we're working on an individual basis with these. So right now we're extending them 90 days, and if the pandemic keeps happening, we may have to extend them a bit longer. So online training, here is what we are doing. So our OH&S awareness training, so OH&S, WHMIS, lockout, tagout, excavation and trenching, and Nova Scotia confined space entrance attendant. And then our online professional development skills training, we're focusing more on this pandemic. So the mental health awareness, fire safety, financial management, and diversity and inclusion in the workplace. So here's an example of the mental health, kind of a summary on what it's going to be offering here. I won't go through it all. And our diversity and inclusion. Now, I could have done this for everyone, but I didn't want to bore you guys, but these will all be on our website by the end of the week, so you'll see more of them. So this week being NAOSH week, I wanted to get everybody to make safety a topic. Whether you post posters in the lunchroom, if you have an area designated for your staff. So here are some examples: how to properly wash your hands, CPR instructions, choking instructions, flu shots, pandemic planning. I have posters for all of these as well. So if anyone would like a copy of that, I can email you a poster that you can print off. Now is the time to do your yearly orientation. Add a pandemic policy into your safety program or plan. Learn from this pandemic, both professionally and personally. Take the time to slow down. Spend more time with your family and your friends that you're missing. Road construction started this week, so slow down. That's somebody's family on the side of the road. So be patient, be kind, buy them a coffee, give them a bottle of water. They do appreciate it. And that's it for me. So if you have any information, if you have any questions for me, or if you would like any of this information, drop me an email there, jhead@safetycheck.ca. And that's it for me.
Great. Thanks, Jen. Again, lots of super information. I'm sure everybody's processing it all, and all kinds of stuff to process, and really pertinent stuff, especially this week and every day. Safety should be every day. So thanks again, Jen Fahey. And up next, we have one last presenter, and last but not least, we have Adrian Okano. And Adrian is the Director of Student Services with METI in Sydney. So Adrian, over to you. Thanks.
Thanks, Norma Jean. Welcome, everybody. Just like to say great job on the presentations prior to me. All right, as Norma Jean said, my name is Adrian Okano. I am the Director of Student Services with METI. Today we're just going to talk about who METI is and what we've done during COVID and what we plan on doing. So, who is METI? What services do we provide? What was our initial response to COVID-19? What we're currently doing during COVID-19? What the future looks like? Some pictures and resources, and then conclusion period. METI is a locally owned private career college providing certified occupational environmental health and safety training since 1998. In 2018, METI was honored to be the recipient of the Cape Breton Regional Chamber of Commerce Business of the Year Award. We were very proud as a team to get that one. What services do we provide? METI offers academic programs including 675-hour environmental health and safety technician diploma, plus 5 other full-time programs. We offer over 100 safety and occupational classroom courses. Some of the courses that are responsive to COVID-19 are respiratory protective equipment, or RPE, quantitative and qualitative fit testing, hazardous waste management, maintenance, use, and care of respirators, bloodborne pathogens, and first aid. I'm going to talk about a little bit about RPE, or respiratory protective equipment here. Here you see a picture of one of our instructors donning the equipment. Respiratory protective equipment allows you to safely use air breathing respirators, self-contained and supplied air breathing apparatuses. It's designed for anyone who works under air and anyone who performs duties associated with bottle watch, whether you're within processing, construction, oil and gas. Basically, it's allowing you to enter an atmosphere safely using oxygen. We've been using quantitative and qualitative fit testing during COVID-19. It was a big ask of ours from via phone calls and emails. Here you see a picture of 2 of our instructors using our quantitative fit testing machine. This is a machine that measures the actual amount of leakage into the face piece and does not rely upon your sense of taste, smell, or irritation. The respirators using during this fit testing have a probe attached, and basically it measures the amount of content inside your mask compared to the amount outside. The other version of fit testing is qualitative. This is the most popular one around here. We've been asked a few times to get this done as well. So basically, seeing in the picture here, a worker would put his respirator on, and you see the yellow hood. We would insert that over the worker's head, fill a test agent, spray the test agent in there, make sure the worker can't taste or smell it, and then we give a pass or fail. What other services do we provide? We offer online training, learning management system. Some of our courses are WHIMIS, OH&S, bloodborne pathogens, health and safety leadership training, among others. We also do some consulting. We have a number of safety advisors with expertise in healthcare, industrial construction, maintenance turnarounds, road and traffic safety, environmental cleanup, project and site work, etc. Our consulting team can help out with setting up social distancing guidelines, qualitative and quantitative fit testing, safety inspections, fall protection plans, safe work practices and procedures, etc., etc. At MEPI, we really treat everyone as a family, and as such, our first concern here was our health and safety of our staff, clients, and students. Initially, we put operations on pause. We had a staff meeting with everyone involved and made sure everyone's concerns were heard. Early on in the response, we were reached out to by local nursing homes. They were asking us if we had some PPE. We offered some face shields, fit testing equipment, Tyvek suits, gloves, etc. They were very thankful for that. We also did fit testing on a number of different locations for a number of different companies. Our initial response continued. We brought in extra cleaning staff to disinfect both buildings. We brought in people to strip our floors, wax and buff them. Doors, stairwells, and common areas were all painted and refreshed. We posted updates on our social media pages, our Facebook page, and our website. So we allowed our students and clients to make sure they were aware of what we were doing. We were also in on a weekly call with the director of private career colleges and the rest of the private career college operators in the province. We implemented a regular Zoom meeting with a project team to enhance our current environmental health and safety technician program. So we brought in a number of subject matter experts. We took a look at our program as is, and we said, how can we fix it and how can we improve it along the way? We collaborated with local officials, Chamber of Commerce, members of Parliament, and the Nova Scotia Department of Labour and Advanced Education, just to name a few. We also extended our training certifications as per recommendations. So, what does the future look like for METI and COVID-19? In keeping with the motto of wanting to help our community, we devised a plan to conduct emergency training for individuals who have projects to go to throughout Canada. I've been brought into the office to answer phones and do calls. One of the big things was, I have a job to go to, I need my training, I need my training. So we tried to think of ways to get this done. With limited staff, our doors remain closed, open to the public with limited contact. We went and measured the size of our classrooms to make sure we could enforce our social distance guidelines. We posted government resource signage in high traffic areas to ensure complacency would not set in. Placed visible tape on the floors delineating 6 feet, as well as directional arrows to keep constant flow. I'm sure you've all seen these in the grocery stores. Hopefully you're not all going the wrong way like myself. We did a fit for duty COVID questionnaire, making sure everyone was healthy when they came to a class. We developed safety treat bags for students containing respirator wipes, pens, gloves, N95 respirator masks, procedures for donning and doffing. Extra hand washing stations have been set up throughout the school, and a plan was developed for over the phone payment, email transfer to reduce the contact. Continuing on with the future, safe hand washing guidelines have been posted in all of our washrooms and common areas. Trainers must not use reused pens, pencils. It is recommended that the trainers discard or have the students keep them for their personal use. There will be no group work. All students will be required to work on their own. Only trainers are to pass out worksheets to individual students. Students should not touch other students' worksheets. Here are some pictures and resources that we thought were helpful around the school. We developed a donning and doffing procedure for putting on your N95 respirator. This is all posted for the students to come in, check it out before they get to the classroom. Communication is done prior to all students coming here, therefore they know the process is in place. We posted a Know the Facts information sheet on coronavirus. Again, more government resources that we thought would work for us. Social distancing, again, high common areas, make sure people are understanding what we're trying to achieve here. Proper washing techniques, all of our washrooms are posted. Also in other common areas, just to keep a reminder out there. You see our picture of our safety treat bag on the left. We put that together in the hopes that the student will take that, understand that the precautions are in place. When they're done with their treat bag, they take it with them or they put it in the garbage before they leave. And then finally, you see our arrows. This was developed to make sure that we have constant flow. Everyone goes in the same direction. Everyone leaves the same door. Everyone enters the same door. So we're going to continue to reassess, improve, and communicate with our team, clients, and students as we learn additional information and things continue to change. We're here to stay safe, and we hope everyone out there is as well. And I'll leave the questions to Norma Jean.
All right, thanks, Adrian. Again, lots of great information, and good to know all the training and all the essential stuff isn't stopping. It's just changing up a bit. So thanks again, and we're going to bring everybody back up on the screen here. So we'll welcome back Kelly, Dawn, and Jen as well, and Jeremy, keeping us running here. And we have some questions already in the queue, so we'll start with those. And if other folks think of some more, we'll get to them as we go. So we're going to start with our first one here from Barb Archer. She asks, if and when we are able to open, we were thinking of asking guests to bring their own linens and towels. We have dishes that can be disinfected, and they would all have their own barbecue. Do you have any recommendations for a cleaning product? Celtic Air from Port Hawkesbury had shown on their media a service that they were providing that was approved by Health Canada called a fogging service. So that is the question, if anyone wants to raise their hand or jump in.
I'll jump in here. I'm not sure which industry she's in. I'm assuming either bed and breakfast or hotel. However, on the last slide of my presentation, there is a link there that you go in for cleaning up workplaces, and you could probably contact these people and they probably have an answer.
So for a little bit on Barb Archer, it's a premium style camping experience in Inverness County, okay. If that helps at all the question.
Yeah, so if you go through those links, there is one there that speaks about cleaning of workplaces. Sure, if you contact these people, they'd be more than happy to help you.
Have any of you heard about this fogging service? It's new to me.
Fogging? No.
Okay. All right, we'll leave that one for now then.
I have heard of people that are fogging. TerraPure, who used to be AIC, Industrial Cleaners, they told me that they do that, but as far as I know, they've only been doing it HR and Halifax.
Okay, good to know. Thank you. So we have a question here from Paul Kerrigan down at the port. Hi, Paul. He says, we have set up our marina docks, and there are times when two people may be closer than 6 feet. What can we do to maintain the safety, and can it be done?
Again, there's a link online there. But what we've been practicing, I work on an oil and gas site. I can stop there 40 hours a week. I haven't stopped. And anytime we can't accommodate the 6-foot rule, we ask the employees to don half-face respirators at the very minimum. We don't like using N95s because we go through a bunch of them. So they all have their personal respirators. But depending on the situation, you could use N95. Plus, be mindful that you have to be fit tested for N95s as well. And the other thing is the Department of Labor has okayed to use KN95s, which is not approved by CSA, but they will accept them.
Okay, so that may allow them to still work down there. And Paul was also wondering if, and I think you did, this was mentioned in some of the slides, is it only essential services where 5 or less are allowed in the workplace, or is it any workplace?
You want to repeat that?
Is it only essential services where 5 people or less are allowed in the workplace, or is it any workplace? So even if it's not an essential services, could there be, is it just 5 or less, or could there be more than 5 people working, even if it's
So
not?
for instance, this question is coming from the Port of Sydney. So parts of their operation would be not under the essential service umbrella, but would they be under the same ability?
As long as the facility can accommodate the 2-meter rule for whoever is there, then the 5-person group rule doesn't apply. If you can't accommodate the 2-meter rule, then you have to keep it to 5.
Okay. And if an employee gets COVID-19, is the employer required to pay the employee, or is it where they would apply for the program through the government, the short-term government programs, or would the employer be required to pay that employee?
Anybody want to take that one?
Yeah.
I think that would be a question for labor standards, actually.
I think that's our last typed question right now, but maybe we'll just give it a moment to see if we can prod any other questions from anyone.
And in the meantime,
there have been so many.
Exactly, yeah. And in the meantime, we do have a slide that we often put up at this point during the webinar. It helps provide us with your feedback. It helps inform our future webinars. So when that comes up, if you want to take a minute and answer those 4 questions, and any other, and you can type in any other questions that come up. And as you see there, Jeremy just posted up the contact information of our 4 panelists, our safety experts of the day here.
Unfortunately not, Kelly. I would love to say otherwise, though.
Well, I don't see any other questions coming in. Was there any other comments from you guys that you wanted to make?
I'd just like to thank everyone for their participation. It was very enlightening. And Kelly, I'm sorry that your mic didn't work out there, but your presentation will be available there, and I'll certainly look it up again.
Yeah, for sure. And all of the presentations will be available. And we want to thank all 4 of you for your expertise and for donating your time to us today, as well as getting your presentations ready, and very informative. And like I say, I'm sure folks will go back and take a peek at the slides again and get specific notes for themselves. So Jeremy, is there anything else that we should mention?
Well, we actually do have a few last-minute questions. I don't think they'll take very long to answer.
Okay.
There are, for the benefit of our presenters, there are several thank yous coming in from our attendees. So thank you again to all of you. We have a question from Lori, if you'd like, Norma Jean.
Oh yes, I see it here now. Sorry. Yeah. Do you think wearing masks at work will become mandatory, or do you think it's a good idea, even if you're non-medically working?
Anybody want to jump in? From everything I've heard from the medical field, I don't think wearing masks at work is going to become mandatory, unless you cannot comply with the 2-meter rule, then you would have to make accommodations for that. However, if you can comply with the 2-meter rule, masks, especially just the regular medical face mask, is meant to protect other people, not yourself, to keep the droplets sane. Therefore, it's not going to be, it won't become mandatory, because if you do have COVID-19 or you think you've been exposed, you would be in self-isolation or self-quarantine. You would not be able to.
True. Yeah, good point. Great. Well, thanks, folks. And I did want to mention that we have another webinar, another one coming up on Friday, where we've teamed up with the Cape Breton Partnership. We've teamed up with the Strait Area Chamber and Commerce, and we're offering another webinar on navigating the Canada Emergency Wage Subsidy, and that features Grant Thornton. So that will be held on Friday, a little earlier. It's at 10 a.m. And you can watch our social media for further information on that and how to sign up. And as well, a week from today, we're doing a webinar all on the arts sector. So we'll have folks who can provide some information on that. So stay tuned for that. And again, thank you for your patience for our technical glitches there. We appreciate you sticking with us. And yeah, Jeremy, any other thoughts?
I think that covers it all. Thank you very much, everyone. As Norma Jean said, please join us again on Friday for our next webinar and for our future webinars as we move throughout this pandemic.
Thanks, everyone.
Thanks, everyone.
Thank you, everyone.
Have a safe day.
See ya, guys.